Is the KMPDU Regional Secretary Central Kenya. He's in the hot seat of the Situation Room this morning. Daktari, good morning.
Morning, Do.
How are you doing?
I'm doing well. Quite a chilly morning.
It is.
Maybe that's why I came to the hot seat.
It is true. If anything, we'll deliver the heat.
Bring it.
All right. You're here because it could actually make its way into the Guinness Book of World Records. And it's not necessarily a good thing.
Yeah.
But we'll talk about that in just a minute. And we're going to give you some work to do because Dennis went to Zambia. He's brought something back. He'd like to know what you think about it.
Yeah, Zambia, population of 20 million people. We're talking about over 70 ethnic groups and official language being English that is used in school, businesses and government. But widely spoken languages as well in terms of the communities there. We have the Bemba, we have the Nyanja, Ochewa, Tonga, Lozi, Lunda, Kaunde and Luvale. Don't mistake those names to be coming from the western part of the country. No, those are for Zambians, right? But let's go to our proverb today. A small tick can cause great sickness. A small tick can cause great sickness. How would you interpret that?
I think what I'd get from that is most problems usually start very insidiously. So you tend to want to ignore problems when they're small. But if you ever look back at any big problem, there were clear warning signs from the word go. So that's how I'd take it.
Good. There were small problems from the word go. Yeah. You should have looked into them. All right. What's happening in Kiambu? It's a very basic, rudimentary question, but hey, let's go with that sometimes, no?
Sometimes I also ask myself the same question, what's happening in Kiambu? Because Kiambu is the second largest county in terms of like the budget size it has, population size it has. So essentially Kiambu is a heartbeat away from being the center of the country. So in Kiambu, we currently have a strike that has now reached 12 weeks today, 84 days. That's the longest strike since the history of devolution. The current record is held in the 2016 strike for 100 days. So we are heading towards now even putting all strikes together. Kiambu beating that record, unfortunately.
12 weeks.
Yeah, 84 days.
84 days, but the other one was 100 days.
But that's at the national strike.
That's at the national, not at the county level. All right, I thought my math had done a doozy on me. Okay, let's go.
Yeah, but the problem is not a strike. A strike, as a doctor, I'll tell you, is like a symptom of something underlying. When you see a strike, there's a problem that now that is manifesting as people going on strike. So what we have in Kiambu is essentially just a collapse of the healthcare system to a level where doctors who we tend to look at ourselves as the guardians of our healthcare system in its entirety just had to down its tools back in May. And since May, we're still on strike. Hospitals are not functioning, hospitals are not working, services are not being rendered, and we have a county government that is just comfortable, just passing time.
What are your demands as doctors to the county government, and have you at any point had discussions to solve these problems, and if so, if not, why? If so, mefika?
Yeah, so the strike actually originated from a previous strike in 2024 where the return to work agreement was signed back in May 2024. Many counties implemented what had been agreed, but unfortunately for Kiambu it did not. So starting from that point, you move to late 2024 where we try to go for conciliation. Conciliation is where the Ministry of Labour sends like professionally trained conciliators to bring people together. It's kind of like therapy for warring parties. Unfortunately, they did not show up for that. So then again, we tried direct engagement with the county all the way in early 2025. And when it came to May 2025, this was now a year later, we had no other choice. So we gave a 21-day strike notice, which is 3 times longer than what even the law requires you to do, because we really didn't even want to go on strike. We just wanted engagement and a way forward, because these things had already been agreed upon. However, the county did not engage at all. In fact, 0 meetings, 0 communication. What they did was on the eve of the strike, the day before, they rushed to court because they wanted to get a court order barring the strike. Unfortunately, I think judges have become wise enough to know these gimmicks that county governments do. So instead of giving orders ex parte, which is just giving orders without listening to both parties, the judge was quite wise to say, bring both parties, I want to listen to them. And when the judge listened to the issues, he actually dismissed the entire case by the county government, rendering the strike legal. Now, after that, we've now been in a protracted strike that is protected by law. Whereby, again, the Ministry of Labour stepped in again saying, okay, this time, are you serious for conciliation? The county has come. Again, we've agreed in principle on all the 10 issues. I can go through them if you'd want me to. However, ending the strike seems to be a problem for them because, unfortunately, one thing we did is, I'm saying unfortunately, but it's still the right thing to do, is we decided this strike we will do it differently. We offered what we called a minimum service protocol, which means as much as doctors are going on strike, we will give a doctor from the union, a member of the union, to be at the emergency service sections of every hospital to make sure that if anything happens, an accident, any emergency service, someone comes in labor, at least they can be seen by a doctor, stabilized, and then referred to another facility. Now, that is good because it protects life and limb. Unfortunately, if you have an intransigent employer, they can get comfortable with that, right?
After all, people are not dying.
People are not dying, exactly. So as much as we've been engaging and we've been having discussions and we've agreed on the issues, which were already agreed upon anyway, they seem to be a bit comfortable with that. So that's why you can see we are now like on the 12th week.
My question is, you earlier said hospitals in Kiambu, nothing is happening.
Yeah.
What's the impact then on patients in terms of health service delivery? What's happening?
Yeah, so
people moving out of the county to other places. What's going on?
Yeah, so what we are seeing with our hospitals, because we look at weekly reports from the hospitals, the wards are empty essentially. You can't get any form of advanced treatment. So yes, you can be stabilized, but if you needed, for example, an operation after that or something scheduled, you'd have to go to the neighboring counties of Murang'a, Nakuru, Nairobi. A lot of people are coming to Nairobi now to seek treatment. The other problem you're seeing is because you don't have enough staff, even the level of care is not that good. Because remember, our hospital system works on like a pillar of doctors at different levels. So even if I'm stabilizing a patient at casualty, you want a very senior consultant to be around and on call in case that emergency is quite a serious emergency. So we are also seeing increased levels of mortality. For example, Roiro Level 4 Hospital, before this strike, had no maternal mortality. This is a mother dying during childbirth, which is something that should never happen in the year of our Lord 2025. During this strike, we've lost 2 mothers, unfortunately. Same to Thika. 0 maternal mortalities. During this strike, we have had 2 at the Thika maternity. And these are numbers that we had gotten to a point of eradicating completely. So mortalities have gone up. I think, Dennis, you saw... let me just mention the name because he's a public figure. The comedian who used to imitate Rigi G.
Oh, yes.
He died at Kiambu Level 5. Yeah. And sometimes I feel bad bringing up prominent people, but the people who everybody knows. But everybody who dies is a prominent person to their loved ones, right? They are loved. They're appreciated, they mean something, they have memories together. So, but as much as I bring up these names, and I think also you saw the story of a gentleman with his grandchild crying at Igegania Level 4.
Oh, yes.
Yeah, that was also during this strike at Kiambu.
All of these horrific things are happening during the period of this strike, because I was going to ask you, so then what's happening at the hospitals? But, by your own admission, you've talked about empty wards. People are not coming here. Say for an emergency situation where there is a begging for somebody to do something about that. And so we're talking about level 5s, level 4s from Thika to Kiambu itself, and then, across board, Tigania, this area. All of this is not happening, and there's comfortability from what you say from the county government in terms of, okay, well, nobody's dying, but except they are. Nothing is really moving, except it is. And from what you're also saying, that essentially the ball is in the court of the county government to now move the needle. Is that the case?
Yes. Because essentially, when you go on strike, 2 people must engage, right? And as much as we've come to the table, we've agreed on these issues, the county must then come and say, okay, fine, let's sign on this agreement. and we start the process of implementing it. But then when you just decide, you know what, we have more important things to attend to. We have a devolution conference where we want to go showcase our small piglets that we give our farmers, and trying to manage the situation almost like a PR nightmare more than like an actual problem you need to solve. So they come out with statements explaining, oh, this person, why they died is because of this or this incident. Like I think last week there was a lady who had come to a hospital with a pregnancy, and the child inside had succumbed, unfortunately. We call it an IUFD. And in such a case, you need to deliver the dead infant. And the mother had stayed there for a long time. Right? They should have this attended to. And someone recorded the video and brought it up on social media. And they have a team of bloggers and PR specialists who come out, bring out these statements, addressing what specifically that issue had to do with, instead of just addressing what the issue is. I mean, Kiambu is a place where very many people, even in Nairobi, live in Kiambu. Anything can happen to you while you're in Kiambu. So it is almost a matter of national importance that Kiambu, as the second largest county, should be up and running. Otherwise, you can't talk about universal healthcare, you can't talk about all these other big programs you want to roll out when you have such a big, important part of the country that is not working.
Okay, so what are you all asking for?
So our issues ranged from several things, but the first one was actually employing more doctors. Okay. Because if you look at the ratios of doctors to citizens in Kiambu, it's one of the lowest, even in the region. Like, we're not even comparing it with a modern-day developed Norway or Sweden, but if you compare it, for example, with like Nyeri, that's one doctor for every 5,000 citizens. People like Muranga are down to like one doctor to 5,000. Kiambu is almost 1 to 9,000, 10,000 doctors, right? Because Kiambu has 300 doctors for a population that is almost 3 million. And the worst thing about Kiambu is there's a lot of inflow of people in and out of Kiambu. And the problem of shortage of doctors is actually a problem at very many levels. One, it's about patient safety. If you are to board a plane, Dennis, and you are told this pilot since Monday has just been in the air, on the runway, on the air, I think most people would say there's no emergency worth risking my life to fly with this kind of fatigued pilot. So when you have a shortage of doctors, that's the first problem that happens. The second thing that happens is you start finding people suffering from burnout. Kiambu is the same county that we've lost, just in the same 1 year, we've lost 2 doctors to suicide. There was a girl, a female doctor in Gatundu, if you remember. There was also another doctor in Fika level 5. These are hospitals in Kiambu. And these are the ones who become prominent because they've had to take their own lives. But we have a lot of people who have succumbed.
For somebody who doesn't know, why do they take their lives?
Yeah, and you look at if you look at the specific issues why they, for example, if you read the letters they left, it's someone who becomes troubled at different levels. Your salary is late, you're facing a lot of social embarrassment where your houses are being closed, there's a lot of breakdown because remember you're working 76-hour shift. You can imagine having a spouse, and the last time I saw you, today is Wednesday, the last time I saw you was Sunday night.
Oh, hold on. 76 hours.
Yeah.
Okay, so let's say that...
I can tell you how a 76-hour shift looks like now.
Let's do it. Okay.
I come to work on Monday morning, fresh.
What time?
Give or take, I'll be honest, maybe a few minutes before 9.
Okay, 9 o'clock Monday morning.
I enter, I do my work. At around 5, people who are going home go home. I remain because I'm the one working at night. Right? So
you're 9 a.m. still working at night?
Yes, I entered in the morning.
Yes.
But if someone comes at 8 p.m., for example, it's still me who will stabilize them. Okay. We go to theater. So, and that is me the whole night. Then in the morning, the same people who went home find me again.
At 9 a.m.?
Yes, at 9 a.m.
Okay. So now Tuesday morning at 9 a.m.?
Now Tuesday morning at 9 a.m. I'm there. Okay. If I'm lucky, I have a car. Maybe I have some few things I can freshen up in the car. If I'm not lucky, I have maybe a room. I've left a few things there that I can just freshen up. People come. I'm the one who was there at night, so I tend to even be busier because I know everything that happened. And as people work during the day, they go home. But then there's a night shift to be covered. So I remain.
You're still here?
Yeah.
It's now Tuesday, 9
This is
p.m.
Tuesday now, 9 p.m., 1 a.m., 2 a.m.
That's Wednesday.
Now that's now Wednesday morning. Now on Wednesday morning when you come to work, you find, Aseto is still here. So tell us about Tuesday night and what happened. So there's this patient, we took him to surgery, they need another surgery, I'm going to scrub in for that. Luckily for you now at Wednesday around 4:30 is when now you can go home. That's a 76-hour
AM
shift.
or
PM.
So now we've gone to Wednesday,
Yes.
4:30.
Now that's a 76-hour shift.
Okay. Why are you doing this?
And that's because of the shortage I'm talking about. Because the problem is once there are not enough doctors, you face a problem where if you're not there, what happens? A reasonable employer would say, you know what, I don't have enough staff. We've not invested in enough capacity. Just close the facility for the night.
Dr. Muriuki, just hold on before we even go to reason. So from 9 a.m. on Monday morning until Wednesday at 4:30, this is not a Dr. Muriuki thing. This is what the normal case is amongst doctors. All right.
And with rotas that clearly spell this out.
That you'll be on shift for these hours.
You know the thing with a rota, I can give it to you and someone can call you and ask who should be on call, and someone will say, it's Okari who should be on call. Right?
Okay.
They're looking at a rota that clearly has Okari from Monday
to Wednesday at 4.
Right. So
all right.
it's not Okari going out of his way to be generous with the public.
Like I'm just going to hang out here because I don't have anything else to do.
Yeah, I'm bored. Or I'm trying to avoid going home. No.
I need the brownie point.
I love my job.
All right. So during these hours, TV has spoilt us. Because we would imagine that, there's an on-call room somewhere. Then you can go take a nap for maybe like an hour. You take a power nap, freshen up, do the business. Does that happen?
Unfortunately, most of these facilities don't have call rooms. Some have rooms that used to be call rooms back in the 90s, but then they're not places you can actually sleep. So what most doctors tend to do is, because you're lucky enough to have a car, is you retreat to your car for a couple of hours.
But you're on call.
Yeah, you can't even leave. Because remember, if something happened and someone can come and say, Dr. Ndu was around, we called her, she took 45 minutes to come, we lost the patient. Now that's a disciplinary that begins there. So as much as you're resting in your car, you really need to still be around. So you, put your chair down. If you're lucky, you can get maybe an hour or two of sleep, if that's a calm night. But again, as I said, Kiambu has so many people, you'll rarely find nights that are really calm. Because even if you look at the numbers, for example, Thika Level 5 has just its maternity department, has numbers, that if you look at the deliveries per year, has numbers that rival Pumwani, which is an entire hospital, which is an entire maternity hospital. So for you to even imagine you'll get a couple of hours of sleep, that's very unlikely.
Actually, there's a hospital, I will not mention the name, where I found this nurse that I know. So I was going in to see a patient, and I stayed for a very long time. And in the morning, again, I was making another trip. And I'm parking my car, and 3 cars are next to me. I see her coming out, and I'm like, good morning again. Like, yeah, good morning. So I later look at her, and I'm thinking, you need coffee. The way you look, you need coffee. She's like, Dennis, I've not slept. Kumbe, she had gone to the car to catch a nap. The parking, then go back to hospital. No time to even go home. She didn't look okay. And I was trying to imagine, if you're going for a procedure or you're going to attend to a patient and you look like you seriously need coffee, you look like you seriously need a shower, how are you going to treat these patients? Do patients know the gravity of this issues you're raising? For example, their working hours and all that. Do they even know?
I'd say to a certain extent they know, because sometimes they can tell. There are even patients who will tell you, Daktari, naona leo watu ni wengi. That's a polite Kenyan way of saying, I can see you're fatigued. But also remember, Dennis, the people who come to these facilities, public facilities, are people with not very many options. Right? Like if my father's clinic is at Gatondo Level 5, and that's why we come, I have no other choice. So if this is a doctor who has to see us, they have to see us. They as much as I might empathize with them, it's not someone who feels like they have the option of saying, you know what, this is not good enough for me, let me just go to the nearest AR or avenue.
So does the patients know you've established that? But now let's get it back to the responsibility bearers, right? So here's a question where now is the county your employer? And this is a situation where budgets have been put in place. Doctors are supposed to be in office. You've issued your strike notice and you're now in this strike. Does the county really care about its citizens, its doctors, and the services that ought to be given, reading that together with the government's position on universal healthcare?
I think the problem we get as especially healthcare workers is we are trapped in between. We are the service givers, right? But then there's a mentality, especially around the political class, that healthcare doesn't generate enough political currency for you. So, for example, if you're made governor, I know you're from the coastal region, so let's make you governor of Kilifi, for example, and you have a budget to work with. Lots of people will encourage you to build a big building, build a new wing, because that's something people can see, or even better, build roads, build things that people can see. In Kiambu, the idea is really to distribute piglets to farmers. So the governor literally goes giving small pigs to farmers, which there's nothing wrong with that, right? Like that's not to take away anything from agriculture. However, what the failure is of understanding here is people go to hospitals to seek a doctor. In fact, if the doctor is even sat beneath a tree, people will still go queue.
Yes,
right? You see many people even forming WhatsApp groups, raising money to go to India. They never go to India to look at its roads, its airports. They go to look for a particular doctor who can do this operation for my mother. Then we come home and recuperate. Now, if you take your budget and you employ more doctors, nurses, clinical officers, nutritionists, there's a feeling within the political class that that's things that you cannot recover politically, right? Very many people won't have the nuance of understanding that, oh, this governor has really invested in a very, very good neurosurgeon, and now you don't have to go to India. That's something that we need to awaken within our political consciousness, even as a people, that people can say, that hospital looks the same way, but it functions very differently. It has medication, for example. It has equipment. I'm not being sent out for an imaging scan, then bring it back to the doctor. So from the employer's point of view, they know it. It's just that within middle management, they also struggle to convince the political class. And within the political class, it requires a mindset of understanding that there are things you need to do and invest in. And that's development. Because, Dennis, if you don't have, for example, a psychiatrist in a rural village, give or take Kiamba in Kiambu, the people there, the old shoshos and grandpas with Alzheimer's, dementia, that's their biggest problem, right? Like if you want to go tarmac the road or paint the road, that's not what that community is suffering from. They just want somewhere they know there's a new dentist there. Now I can go get my dentures there. I can use the same Maram road that I normally use, but that to me, you've really changed my life. So that's the kind of conversations we really now need to start embracing when it comes to the political class, especially.
But the bigger problem also is we've seen from the Auditor General reports situations where you'll find a county has specialized equipment, but you have no specialist.
Exactly.
And we're not talking about 2 years ago or 3 years ago. We're talking about a financial year of like 2020, from 2020, that there is an equipment that was bought. It's lying somewhere in a store in a hospital. It's covered. It's in dust. And there is nobody to operate it.
Exactly.
So it's not even now. It's a question of having what is priority, have personnel first, then equipment later. And here's a situation where you have equipment, then you're launching the equipment, then the people are saying, oh, now we've got equipment has come to our county, and then that story is forgotten. Is that what's happening in the counties?
Yeah, and you'll see the two major equipment schemes for healthcare equipment, they don't become things that are generated from the user's app. Because I'll tell you, for example, Thika Level 5, you require a headlamp to do a certain procedure. Headlamp is, I think you've seen it even.
Yeah.
This is where you have like the big torch and you wear. That thing is like what, 13, 14, 15,000. But the people procuring this equipment are going to procure and push things down. So as Dennis says, you end up with things that there's either no personnel for that, or it requires certain other things that you did not consider.
Or even a specialized room.
Yeah.
Maybe
exactly.
you need to design a room differently because of what you're putting in there, like
Exactly.
X-ray machines,
Exactly.
MRI scans.
Or you bring the equipment, it works, but then it requires, for example, films.
And then you don't have those.
Yeah.
Then you don't have films because the county didn't budget for films because they were not part of what you guys agreed. And maybe the thing I'm trying to say here silently, but anybody who's clever would pick it up, there's a tendency to lean towards things that have transactional value more than service delivery. Because if you look at equipment, if you look at buildings, these are things with large contracts and tenders. These are things that you probably deal with one or two people in rooms. But if you are to hire, for example, 100 new doctors, 200 new nurses, this is not as any Kenyan would understand what I'm trying to say.
Yes,
It's not
yes,
as
yes.
lucrative as
Yeah.
so it really requires you to go over and beyond just those simplistic political calculations and think what is right here to be done.
What is right here to be done? It's clear that there's a problem. There's a and but the two sides are no longer talking to each other. What is it going to take to have this sorted out? The governor of the county has had talks with doctors, but they seem to have reached a stalemate. Or there have been no talks at all?
Weirdly, and this is actually a big failure politically, the governor has never engaged us.
Really? You've never had a conversation?
None, zero. Which is what is making the strike drag on. Because if you look at other strikes, after a few days, the governor usually steps in. And the good thing with the governor, because he's the one who bears the political mandate and has all the executive power, he can decide to make things move. If you don't engage people, the people who we go for meetings with, sit with, they're also promising you things they are not sure whether they can really deliver, because remember, they've just been appointed, and in Kiambu they tend to be kept on very short contracts. So they're also not on very secure footing. So it's for a strike to last as long as it has, it's tantamount to political incompetence, to be honest. It means you cannot bring together people, solve an issue, and have a conversation. So yeah, we've not met the governor. Yeah.
Is it possible that the solution may lie with him and the people who work around him? Is it possible?
Yeah, ultimately the solution has to come down to him, because the people of Kiambu elected him to run the executive of Kiambu. And what we've done, and what this strike is now exposing, is we are really testing our constitution, because we are putting to test all the institutions that have been put up to safeguard devolution. So we have a petition to the Senate. The Senator of Kiambu, in fact, Senator Karungo Wadhangwa, has even made a statement on this, and the Senate Health Committee, it's just that they're now in recess. They plan to summon the governor. We've made a petition to the National Assembly, the Health Committee under Honorable James Nikal. They're also looking into this. We've met the elected leaders, because they also have been elected by the same people. This is everybody from the majority leader, Honorable Kimani Ichung'wah, Alice Ng'ang'a, all these MPs from Kiambu. These are your constituents. We've made a petition to the county assembly, which again exposes some weaknesses of devolution, because you wonder, as a county assembly, this is literally the job people elected you to do. There's a health committee within the county assembly of Kiambu. How do you have hospitals shut for 3 months, and you wake up in the morning and you say you go to work to represent?
And not a single word.
Yeah.
None, not from the governor, not from the county assembly. So this strike will...
Where are they going to hospital themselves?
Unfortunately, they never go to those hospitals. In fact, I can give you an anecdotal story that happened. I think early August, the governor decided to just randomly show up to a hospital. He shows up to Wangige. Wangige is in Kabete constituency.
Yeah.
He enters and asks, what's happening here? Because the thing is completely empty. I mean, a whole ward, there are only 2 female patients at the end. So where are people? It's like going to a school and the school is completely quiet and there are no students. Are they away? So he asks, okay, let's go to the male wing. And when you want to go to the male wing, you're even told, don't even bother. In fact, men have such poor health-seeking behaviors. If female patients are too, then men definitely, that ward is even closed.
Can't remember when they came.
Yeah. So you end up in a situation where you, even as a member of county assembly, why don't you just walk into your local hospital and ask, okay, you know what, when's the last operation that was done in this theater? Where are my people going to? Right? Like I can go around talking about development and attending church functions every Sunday, but that's not what people elected you to do.
So when you went to that hospital, you were shocked that there were no people?
Yeah. In fact, and I'm happy that he was shocked, because if he was not shocked, then it would mean we're dealing with someone who doesn't care. I think we're dealing with someone who might not really understand what is happening on the ground. That tends to sometimes happen with leaders where your middle-level management do not really tell you what's happening. Because if you hear a governor asking you, where are patients? It means he's expected to see patients.
Yeah.
Right? So he was definitely shocked. And even when you ask for the numbers, a hospital that delivers around 230 mothers every month, you're being told since the strike we've only delivered 30. Where are all those people, Dennis?
Doc.
Yeah.
So let's talk about the situation at ground. We've handled the county is not listening. The doctors are not here. But then there are the patients who are not showing up even in hospital because they know the hospital are not working. But then again, what KMPD has done is you have these doctors on call to at least help in the emergency services. And one would assume the conversations that they are having with the Wananchi who are seeking the services. So what are the patients, the residents of Kiambu who come to these hospitals say? What do they want to see done? Yeah,
no, in fact, I personally have received a lot of letters from residents of Kiambu, people writing to my office because, and I understand, they would assume we are the reason that they're not getting services. So most write, why did you go on strike? When are you coming back? And I tend to reply to every letter we get. And when I reply, we are now starting to see people starting to take up petitions to the High Court. Because the Constitution guarantees your right to healthcare. And if the county government is coming in between that, then you need to petition all the institutions that can intervene in this issue. And they need to step in. So the residents are starting to get agitated. There's a sense of things are not well. In fact, constantly there. I think the other day we saw, I'm forgetting the exact hospital, but there was a big fight because someone is saying, if there's nothing happening here, tell us, we go home. There's no need for you to keep us here. And he had engaged in some scuffle that was it was recorded on camera, him just being upset, beating up a few people there. So you can tell the anger is starting to boil up. And this is the unfortunate thing with healthcare, because healthcare, you cannot cover up rot within the healthcare system. Unfortunately, you can cover rot within many sectors, but healthcare, nobody dies quietly. They are loved by people. They are known by people. That pain remains with the family somewhere. So once you keep it going, you cannot continue as if nothing is happening. So what we are seeing is things are starting to get to a point where even people are going to the Ministry of Health. In fact, the cabinet secretary now wants to pull out all the interns, any learning students that are there. And this is not just doctors. Remember, even nurses, clinical officers, all the interns are going to be pulled out. University institutions like KU, their medical students usually train, because it's in Kiambu County, they go to hospitals such as Kiambu Level 5, Thika Level 5. Now, in fact, just this week, they've signed a new agreement with KUTRH. So even universities are pulling out of Kiambu, because if there's nothing happening, so many people are being affected by this. And this is an issue where we now want to take it to the highest offices in the land, because at the end of the day, this matter is bigger than any one individual.
Dr. Bell, what specific concessions will break this deadlock today?
We've really considered on a lot of things. For example, the right number of doctors to hire were 200 more doctors. The county, we've agreed they hire 77. We're okay with 77 for now. So the agreement we had signed last year for promotions of doctors, let me just say what promotions are. As a doctor, you've gone to school for 6 years. You do internship for 7. At that point, you're a general practitioner. So you're working for Kiambu. But then if you want to become a neurosurgeon, you go back for another 6 years.
Okay, hang on. 6 years plus 7?
6 years plus a year of internship.
Okay, so then it becomes 7.
Yeah, so you're a general practitioner.
Yeah.
Now, the Public Service Commission has a scheme of service that shows you when you're a general practitioner, this is how much you should be paid, this is your salary and whatnot. But then you decide, I want to specialize and become a neurosurgeon. That requires you to go back to school for another 6 years to do neurosurgery now. When you're done with that neurosurgery, you need to then do a further internship on that neurosurgery for another 2 years. So this is someone who's been to school for 15 years now at this point. This is barring anything happening. University striking, getting pregnant, any deferment. So give it 15 years. And then you find a county like Kiambu is paying that neurosurgeon as a general practitioner.
How much are we talking about?
In terms of the difference in money. A general practitioner, and the difference would be even like 150,000 in terms of the difference in the salaries between those two.
Before getting to the difference, gross salary for this general practitioner, how much is it?
Gross salary would be around 200 and something.
Okay.
Yeah.
That's gross.
That's gross.
So then the difference between whatever that general practitioner is earning to the neurosurgeon is the difference is now 150.
To the neurosurgeon now, their gross would be like 500 and something.
So,
but that's according to the public service. And
yes.
Remember, your colleague who you are with in neurosurgery school works for Moranga and is recognized as a neurosurgeon, is paid as a neurosurgeon, but then now you're still paid as a general practitioner.
Yet you're a neurosurgeon.
You're a neurosurgeon. In fact, they give you the work of doing neurosurgery cases. Right? So the work you're doing in the facility, people know, go to Tigoni level 4. Dr. Ndu, we have a very good pediatric or an oncologist there. So they know you're an oncologist, but when it comes to your payslip and your designated papers, they'll pay you as if you're a doctor who finished school in 2022.
Sounds illegal to me.
It is illegal. And that's why when you go to strike, they usually concede on that because that's just so unprofessional. And in 2024 strike, that's one of the things they agreed to, but they never implemented it. So that's, for example, something that initially when we went on strike, our initial demand was these promotions need to be done immediately. Go print those letters, recognize people as per the title of what they've studied and what they are good at. But now we've considered we are even ready to give them a few more 6 weeks to do it, right? So we've really moved on every single issue. The only problem is there's just a certain level of just being comfortable with the situation as is, because as long as it's not there in the public media, it doesn't bother them.
We've had strikes in other counties.
Yes.
But we've not had one that has been so prolonged like this one.
Exactly.
Where, let's hit the nail on its head.
Yeah.
Who's the problem here?
Unfortunately, in our assessment, what tends to happen with strikes, as I said, like Nairobi had a strike recently.
Yes.
You go for a few days, I think 30 days, you call up Governor Sakaja. He says, let's meet, let's talk. What do you need done? I can do that. Give me time. Let me put that in next year's budget. The strike is done. We don't have that with Kiambu. We have a situation where even elected leaders have spoken out about this, but the county is just a bit hesitant, a bit comfortable.
So you guys call Wamatangi and he doesn't pick your calls?
He would not meet you. In fact, even to his fellow colleagues, he doesn't meet them. Because I'd always, as I was saying off air, I'd always assume as a political leader, you have personal friends amongst political leaders. So when we try to go through fellow political leaders to talk to the guy, this is something so easy to solve. In fact, in the history of Kiambu, all their governors, including Governor Waititu, we usually say including Governor Waititu because we consider him as one who had a lot of challenges, would have solved this strike. Because as a political leader, this is your specialty, bringing people together, managing situations, talking to people. And that's why if it requires us to go to the highest levels, to all the courts, to all the Senate and all the petition, nothing will move. Because now once you see the Ministry of Health even threatening to shut down hospitals in Kiambu, it will get to a point where you now cannot use bloggers and PR machines to cover the situation. Remember, they are losing a lot of revenue because at county level, healthcare gives you the most revenue. People are going there, they're paying, SHA is reimbursing you. So other than just a difficulty in personal ego, this is something that is very easy to solve.
Is the Council of Governors, especially the Health Committee, the Council of Governors, picking up this matter, or is it also silent at that level?
We've not gone to the Council of Governors. We've spoken to direct governors. You'd expect them to talk to one of their colleagues. Unfortunately, even that hasn't gotten us a breakthrough, and that's why we really want to put a lot of public pressure, because politicians respond to politics, and we need the politics to now become untenable for you to just become comfortable with your hospitals shut for 3 months, surely.
Yeah.
Just because you don't go to those hospitals doesn't mean people don't go to them. So we are waiting for His Excellency to come back from Japan. And that's the next level we'll have to go to, because now at this level, even he has a political mandate to intervene in such a scenario, because all these people have been elected by the people of Kiambu.
These things hinge around resources, money, and people and places. The 10 issues that you're saying brought to the table, that at the very least, some of them should be ticked off, and not even in its entirety, because you say, okay, hire 200 more doctors, we're ready to go with 77. All right, so give an increase here and there. You're ready to take a reduced amount, even on that demand. What would preclude the county government from acquiescing to some of these things? Do they not have enough money? Do they not? Because you must have heard the chatter that they must have said, well, this is the reason why this, and it surely cannot be that it is because Governor Wamatangi does not have a minute to address the issue in his out tray.
I think the problem becomes, because of mismanaging health for several years now, you have this fear within the system, now within Kiambu, that if you give doctors what they want, the next thing you'll see is a strike notice by nurses. Because remember, doctors are fighting for things that also nurses, just the same way I can give you numbers, nurses have their own issues, and you just then now need to decide to address these issues. So their perspective is giving in shows weakness, and that weakness will really undo a lot of other things they want to do. And their goal is to really not show any weakness, because they know it opens up another door that they might not be able to deal with at that point.
You know, there's an issue here. Every year you have graduates. And there are conversations around how many of these graduates, cutting across different professions, who are then absorbed into the job market. Now, to be specific here now, I don't know whether you have the numbers of how many medical students graduate every year. We have so many colleges and universities around. Do you guys have figures? Do you have figures of how many every year?
Unfortunately, the numbers also keep going up because
of rapid expansion.
Exactly, of universities. Yeah, but we're talking of students in thousands.
In thousands?
In thousands, yeah.
What's the absorption rate?
The absorption rate is not that high, because first after school there's a point of internship.
Yes.
You've also seen us having a lot of issues around interns. So first you need to do internship. Without that you can't get a license to practice. Now after that, the absorption rate within the public sector is so low that a lot of people are now moving towards the private sector. I think you've seen a lot of healthcare chains, AR, Avenue, opening up hospitals everywhere. So that's where most doctors are now going to. Yet a few years ago, even just 10 years ago, almost 80-90% would go into the public service.
Sure.
Yeah. But now most people would be working at these hospital chains that you're seeing.
Or even out of the country.
Or even out of the country, yeah. Especially out of the country now.
Is this something that is worrying the leadership there is? Because you look at doctors going into private practice, that means citizens who majority go to private facilities will not have doctors. And as we just speak in terms of from a policy aspect, not just Kiambu, but from the national government in ensuring that our hospitals are well staffed with enough doctors to be able to meet the population pressures that does exist. Would you say it is a priority not just for Kiambu but for the government to ensure we have enough doctors?
I think it's an interesting discussion when it comes to policy level, because you see the government really focusing on health. They focus on things like UHC, SHA, but health has 7 pillars. There are things like financing, there are things like the personnel. And when it comes to having enough doctors, they consider training doctors as the checkbox has been done. Right? We have more doctors in the country. However, the thing is, you need doctors in public service, because again, if you have a good public healthcare system, you don't even need to spend money on private healthcare. So it saves people in so many different ways. If you could go back to the days where someone would know going to Kenyatta is probably the best option for you, then you don't need to save an arm and a leg. You're constantly being added to WhatsApp groups for someone's fundraising because they need some care, that someone has died and the first bill you need to raise for is for the hospital bill. So all these problems would be solved for everybody, not even just the sick person. So as a policy issue, I think we're still not hitting the nail on its head properly, because we are addressing only aspects of healthcare. Either the health insurance aspect, sometimes we're discussing the financing, the equipment part, but personnel is at the heart of what people seek.
Usually they say there's this tunnel, and right at the end of it there is a shiny light, peephole. Is there one here?
Yes, unfortunately we are making the tunnel unnecessarily long, because at the end of the day, the strike is legal, it's protected by court. The doctors are determined to fix this issue once and for all. We believe we will get these things eventually. No, why are we waiting for another week? Why are we waiting to hit 100 days, 120 days?
Why are we waiting for another hour?
Yeah, why are we in studio instead of being at the governor's office finishing this thing? So the strike will be sorted. The issue is how long, and that lies squarely at the foot of the governor.
So doctors are not in hospitals.
Pharmacists, dentists
are not in hospitals. Nurses, clinical officers, we're essentially saying that we're looking at graveyards around the county. Other counties have been absorbing the sick and those who are in need of medical attention for at least the last 3 months. It's not sustainable.
No, not at all. Yeah.
That's a situation that we look into. The hope is that not another minute. We're not talking about another week to make it 13. We're saying that not another minute needs to go by before something is done about this. Doctors work so hard that they're sick who need attention. There's a lot that needs to be done. It's our hope that this spurs conversations into action that needs to happen. And as difficult as it is to have this conversation, it's important that we do. And then kind of wait and see. A poke in the proverbial conscience of those who need to do something about it. And that's why we have these conversations. Thank you, Dr. Bill Muriuki, for being here this morning.
Thank you too.
We're looking forward to an update, and hopefully a week will not pass before something is done. Good morning, and thank you for being part of Kenya's.
This is the Situation Room, the only way to start your day.